Hi, welcome everyone. Um, as you know, I'm Dr. Sine Rofofsky. I go by he, him, even though I'm non-binary. Um, and I wanted to let you know that I'm hoping that this can be a very interactive session, not me lecturing, because I hate lecturing. I prefer discussing. And that's going to be part of what's in a name because I don't like lectures. I like discussions. Um, so keep that in mind. And I want to ask all of you, um, what do you think this session is going to be about based on the name of it?
Well, this is Phoebe. What piqued my curiosity when I saw the title is, are we going to get more in-depth information about what it means to be a peer supporter?
Um, we might, but really what I'm looking at is um, I used doctor on my slide here, but usually when I'm working, I use Mr. because I don't want to, because the students and kind, if I'm talking to faculty, I use doctor. If I'm working with peers, either in the college or as a peer specialist, I don't use the word doctor because it usually scares them off and makes them think something about me that I'm not a peer with.
So, with that being said, then my thought now is um, the use of pronouns and what that is all about.
I can definitely cover pronouns. I do a lot of work with them. Self-worth, person-centeredness, personal identities. Definitely that's what we're going to be looking at is, you know, how the person views something and also how we view it and what how it can impact your interaction with someone. Something as simple. 2 days ago, I was being introduced to a new faculty member, and so was my colleague. And I'm the only one in my department with a doctorate. So my supervisor said, "How do you want me to introduce you?" And I said, "Well, are you trying to impress or are we trying to collaborate?" And based on that, pick the honorific you want for me. And she said, "Thank you." And she used doctor because she wanted to impress the faculty member. So, why are we doing this session? One reason is in my own personal experiences, working with students, working with faculty, working with peers, working with basically anyone, or even interacting with anyone, or having people interact with me. Um, I realized what you call something, the name you use, the pronoun you use, the word you use, it can mean very different things. Um, if I told you I was putting a jumper in my boot, um, would you think I was crazy? You can say yes, it's okay.
I would think you were British.
Good. But if you didn't know that they were the British terms, you'd think I was nuts. So and that's just like an example is between cultures or between even between areas. I'm on the East Coast. And when I was communicating about the conference and the time, I had to keep putting in what time zone are you talking? Because I'm on a different time zone. And without asking that, I would have been presenting this 3 hours earlier because it's 5 o'clock here. So if I was presenting at 2 o'clock my time, then no one would have shown up and I would have been very disappointed. So it's, just remembering that context makes a big difference. Even something like, let's talk about China. What are we going to talk about?
Could be a country or it could be dishes.
Right, dishes or the country. So you need to give context on that. So that's a lot of what I'm talking about. I've done a lot of research, presentations, and some writing about how different cultures phrase things and how if you phrase it wrong or you do the wrong motion, even it's not just the verbal, but it's your body language, you can really turn someone off. You know, if you do the victory sign in the US, the V with your fingers, that's a positive. If you do it in other countries, you might get your mouth washed out with soap. So it's just being aware of the cultural differences. And again, my interactions with others always confuses me. And I figured this would be something that others are also wondering, why don't you want to do this? And it could be as simple as you using the wrong term, which happens to me a lot. So terms have changed over time and they continue to change. And as they might be giants have said or sang in the past, and I'm not going to read it to you, you can read it or sing it to yourself. And yes, I'm dating myself, I'm old. Okay. So this really is like the basis of, this is just one example that really comes into my mind every time I talk about this. Do you have any thoughts about how this might impact you or not impact you or the peer you're working with? Okay. Maybe in time, maybe as we go on. Okay. So the English language, I study languages and I find the English language to be so confusing. We have so many words and phrases to convey the same thing, but which one is the right one to pick? And we're never going to get it right all the time, but being aware and connecting with it is a way to, and connecting with the person you're talking with, understanding them is really the key to being able to pick the right words. I will never go to the cardiologist. I refuse to. However, I have no problems going to the heart doctor. And I know that sounds silly, but I don't like going to ologists. I will go to doctors. Call them simple. For other people, they won't go to the heart doctor. They'll go to the cardiologist. So being aware of how people react to words you use is something very important to be aware of. I cannot follow a schedule. For me, the word schedule sets me off. I will not follow a schedule. If you tell me let's make a timeline, no problem. I'll do it. What are some words that you might have problems with that might trigger someone, and how might you word it differently? Or that might trigger you and you would prefer worded differently?
I have a weird one, which I mean, I don't know that it's related. I don't know if it's related to something or not, but I hate the word cuddle and I like the word snuggle. It's a simple one.
Exactly. And you would react differently if someone used one or the other. So
And I guess a lot of that is just because that one you couldn't necessarily guess. I know culturally we can be more or less sensitive, but sometimes it's just very individualized.
It is, but if we're paying attention to the other person's body language, we might be able to say, oh, you don't want to cuddle? Maybe you want to snuggle today? And we could try using an alternate term with and seeing if that gets them more willing to consider or do something. Because we're guides, we're trying to help our peers to navigate. But if a term scares them, we need to figure out how can we best communicate where it's not as scary. Even if the terminology feels weird to us. And sometimes you can even say, what do you call? And use their term if you can. So that's something to keep in mind is it might not be that they don't understand the word, though it could be. But sometimes it's just what triggers you. Yep, exercise is horrible. I hate going to exercise class. I love going to my body pump, but I will not go to my exercise class ever. I'll go to body pump every day. And the word change can bring up something bad, but how about asking them to evolve? Thank you, Tyrese. Did I get that right? Again, it's what makes or encourages you to be more open to the concept. Danielle, thank you for the exercise example. Or sorry, thank you for the being active example. I should use the term you like. So it's all things like that. It could be something as simple as, do you want to use a pen or do you want to use ink? Or it could be something as complex as, let's make a shopping list and go shopping together. Or what's another way you could say that? I know I'm making you all think, but it's earlier in the day for most of you, so you should probably be more awake than me.
Could we say something like, let's go see what items you might need?
Good. It could be, instead of saying, let's make a list, let's take an inventory of what we should get today. You never know which one's going to work. Sometimes it feels awkward or stilted to use alternate terms, but that might be the way that they prefer to speak. So it's, again, just being aware. So some food for thought. I brought up a few of these. Does it matter if you're going to the doctor or the cardiologist? Does it make a difference? You're still going to get there. It's just, what did you call them? And some people just like to say, we're going to Dr. Jones today. They don't even want to mention the terminology, the word, the type of doctor. They just want to go to the person. So does it matter? Well, to the person listening to you, they may be turned off. For you, it's probably you're getting the same end result. So sometimes being resistant to suggestions isn't that they're resistant to the suggestions, which my peer specialist and I learned about me very quickly. It's that it was worded wrong and it was triggering me. And that was our problem, was the terminology was triggering me and I wasn't being open to things because I didn't want to deal with them. So is a meeting the same as an appointment? Would you go to one over the other? I know if I'm working with a peer or if I'm meeting my peer specialist, I hate when she calls it an appointment. It feels too clinical. I hate it. Meeting, no problem. That's fun. But going to an appointment, it feels like, oh, I hate those. Those are so boring. It's doctory. So that's something that, you know, and, you know, do you use a schedule, a plan, or a timetable? Which one is most, you know, appealing to you? You know, I don't like carrying a calendar. I like carrying a planner. So, and one that I've used quite often because I do a lot of education work is when you see a person at the front of the classroom, what name or title would make you feel welcome and open to learning? And what would make you shiver in your shoes and want to run away?
I mean, I think I don't personally relate to this, but maybe professor is difficult.
Professor can be difficult for some people. Doctor. And then for other people, I've had professors who insist that I call them by their first name, and I could never do it.
Mm-hmm.
And they pushed me and pushed me and pushed me. And I started hating them just because they wouldn't let me use the level of title that I'm accustomed to.
Mm-hmm.
And it was such an argument. It was like, you have to call me by my first name. And I'm like, no. And to this day, anyone who's taught me is still professor, even if I'm collaborating with them or meeting them for coffee. They're still professor. I will never call them by their first name. And that's something that's kind of important to pay attention to is also, what do they call you? Do they call you their peer? Do they call you their navigator, their coach? What name makes them feel most comfortable with you? And for those of you who do work in the field a lot, what term do you see people preferring you to use? Or does it change?
I just go by my first name
That's a
in the
great way to
field.
go.
Yeah, I'm just, so, and I don't wear a badge or anything. I work for the county for our behavioral health here, but we do a peer wellness center. And so we're out in the field a lot, or we have a lot of peers coming to our wellness center as well. But yeah, there isn't anything, it's really whatever makes them feel the most comfortable and safe.
Right. And Tyrese, it does alter. Chloe, yeah, the friend can be, I have a hard time dealing with the word friend because it's that, for me, that kind of like breaks down that professional barrier that we need to have. And it makes it harder for me personally to deal. But if that's the term that they want, I have to decide, can I get over that enough to properly do my job? And yes, it does differ by age, culture, gender, backgrounds. It could be anything that causes a change. My peer told me 6 months after we met, because she obviously learned my background, she said to me, I was so scared meeting you because you have a doctorate. And I was like, really? I'm just another person. I don't use the title. And she was like, I don't care. I was so scared. And you are just not like a doctor or, someone like that. I was like, no, I'm not. But without meeting me and getting to know me, she was more freaked out than I was. And let me tell you, I was freaked out meeting her. It took 3 or 4 times before I finally walked into her room and actually talked to her. I just wouldn't talk to her. So again, what do you call it? Even that first meeting, you have to think, what's going to make them most comfortable. And when we meet people nowadays, if I'm meeting someone, I tell them, "Hi, I'm Sine, he, him," or I'll ask them, "What pronouns do you prefer?" Because well, I'm non-binary, so it's very hard to tell when you look at me what gender to use. So it's always appropriate to say, what are your pronouns, or what pronouns do you prefer? And by the same token, what would you like to call me? And go from there. What would you like me to call you? Do you want to be my client, my peer, my recipient? I'm sure my friend. What do you want to call me? So again, it's being open, being aware, and sometimes if I don't want to say, what do you want, I'll just say, "Hi, I'm Sine. Um, I use he, him," and I expect the other person to respond, "Hi, I use hi, my name is," I use whatever pronouns they use. That's the most comfortable way in the LGBTQ culture, is if you introduce with your pronouns, we'll return with ours. So that's always a fun one. Okay, so who are you? Thinking back to your childhood, if you were called Johnny by your parents in at one time of the day, and another time Jonathan David Smith at another, did you react the same when they called you both ways? Terry's definitely no. One of them, what do you find is the difference between the two? Anyone?
Well, in that case, I think oftentimes children were called by their full name when they were in trouble.
Yep. If I was called with all three names, I knew there was something going on. If I was called by my nickname, I knew there was a good reason to be called. But those three names, I was like, "Oh, what did I do? I don't want to go talk to you." So again, it's, I'm using a lot of different examples. Like if you meet someone and you see their name on their paper, you can still say to them, "What would you like me to call you?" Even if their name is something as simple as Sarah. You could still ask, "What would you like me to call you?" Maybe they prefer their middle name. Maybe they prefer some totally non-legal name that they just like being called. So it's very important, because if you call me by the wrong way, I'm going to react to you very differently. And in the same way, how they call you, again, is going to be very different. My therapist is Jane, because we have a very different level of interaction than my psychiatrist, who I call doctor. To me, they both help me, but I wouldn't feel comfortable opening up as much to my therapist if I had to call her doctor. And again, that's just me. Other people would have other reactions, and that's where it comes into, again, being aware. And sometimes it just means watching if someone shivers or shakes or becomes colder towards you or warmer towards you as you use different terms. So what might impact the words that you choose? Well, already brought up was age or generation. It could be generational, or it could just be age. If I said, can you go Mimeo this for me? Does anyone know what I'm talking about? You could raise your hands also if you know what Mimeo means.
Yes, but dating myself, it's photocopy.
Right. It was this big circle thing with this blue ink that you could get high on. And it was used to make copies before copy machines. So, or if I say, can you get me the sellotape as opposed to scotch tape? It's just what your generation uses. It could be the culture. So can anyone think of some cultural examples of where if you choose the wrong word, it could cause some issues? Give you a hint. Merry Christmas. That's not a way to greet me. I'm Jewish. I will respond Merry Christmas, but I always feel awkward because it's like, okay, I respect that you follow that, but I don't. Can anyone think of another example? Auntie or uncle? Definitely. Some cultures use them as honorifics rather than just blood relations. So being aware of that, like, why do you have 75 aunts? Because you've mentioned 75 different aunts in our meetings. They're not, but they're my aunts. What do you mean aunts? Try to understand it without being law, without being rude, but try to comprehend what do they mean. It could be the primary language. I know a very, 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 very long time ago, the Nova car was, there was a myth going around that it wasn't popular in Latin America, and no one could figure out why. And the myth was because the name of the car was No Go, no Va. Va is go, and that was the running, myth. Was it true? Who knows? But it was just knowing that. Or again, bonnet. If I say he, if I'm speaking in Hebrew, I mean she. And being aware that sometimes it may be confusing because I switch languages without warning, that I might inadvertently say the wrong word and people will wonder, what are you talking about? So being aware of languages and how they are are received and where words might come across weird. And again, the context, where and when the term is being used. A schedule, sometimes I will like because I like to see the schedule of the movies, but I don't like having a daily schedule. So it's the context. When are you using the term? Where are you using the term? And sometimes it's education level just because, or knowledge level, because you just might not have the same vocabulary exposure that someone else has. So trying to not dumb down your language, but try not to. Now I'm stuck for a word. Um, I call it academicize the word or professionalize. Don't use the most professional term unless you're trying to portray that it is a professional aspect, because that can, if I don't understand the word, I'm going to be totally confused. So there's those things. If people keep mentioning, I always forget what it's, not heart attack, but micro, help, help. The medical term for heart attack And
Oh, myocardial infarction.
thank you. Someone told me that they had one of those, and I looked at them like, okay. And then they said, I had a heart attack. And I went, oh, how are you? Are you okay? Do you need anything? I had no idea what they meant. Yes, Joseph, out, you don't want to outshine the person you're working with or the person you're interacting with. And this isn't only between you and the peer, but also when you interact with people around the peer. When I'm out, like if I have life skill issues, so my peer would take me out to do life skill activities. And if we ran into someone that she knew, she would introduce me as her friend. And if we met someone I knew, she would introduce herself as my friend because she didn't want to expose that receiving services. So a good one of the initial discussions before you're out in public with someone is, when we run into people, how would you like me to be referred as, or what would you like me to be called? Because I could refuse to go out in public with you because I think you're going to call me your peer or your client, and I'm going to freak out because I don't want people to know. So it's opening up those discussions. And I know it sounds simple, but how many times do you have a discussion with someone of, what do you want me to call you? What do you want to call me? When should I call you this and when should you call me that? Is that a normal interaction that you have with peers when you're working with them? Because I'll say it takes me effort to remember to do those.
That's one of the things I was wanting to bring up, is all of this sort of takes going a little more slowly and extra effort, I think. And I was wondering how your experience around that.
I will say I make mistakes a lot. And I've been studying and practicing this for 20 years. And I still make mistakes. But I try to be more aware, and I have a little checklist that I keep hidden in the folders or somewhere, or like in a piece of artwork on the wall, some keywords that remind me, discuss these so that I don't forget to. And then also I have to remember which one goes to which person. And that alone, because I have a poor memory, I have to put notes on everyone's folder so that when I talk to them, I remember what I have to quickly check before I walk up to them. I have to check my notes either on a folder or I have a file on my phone just to double check. What am I supposed to call you? Who do you call me? Thank you. Okay, now let's talk. Now I can talk to you. And I will admit to people, I'm sorry, I forgot what you want to call me. I'll admit I forgot. Shows I'm human. But it is very difficult. It's mostly practice and building your own vocabulary, thinking like we're doing in this workshop. What are other ways to call things? What are some words that seem to trigger people that I work with? Now, what else could I call it? How else could I phrase that? So, do you have any words that you might be encountering that you can't figure out why people, want to consider it?
Can you repeat the question again? I want to make sure I understood it.
Sure, sorry. So what words have you used with people and you've realized, well, no one is open to this. Why not? An example for me would be when I work with people, instead of saying, do you want transit training? because that's one of my specialties. I'm very big with public transportation. I'm well versed in it. I cannot drive and I cannot give you directions for my life, but I can take you on the bus anyway. Yes, it's funny, I know, but it's unfortunately the truth. And everyone knows that about me. So when I say, you want to do some travel training? No one ever wants to do it with me. When I say, you want to go ride the bus together? Sure. And I always forget that I shouldn't use travel training. I'm working on it. Takes time.
I think the term case management, a lot of people are trying to figure out another way to conceive of that or refer to it in their organizations. And then it gets organization specific, I've noticed.
Yes, that's the other problem is if your organization calls something one thing and another organization calls it another, and someone gets serviced by both of those, that can be even more confusing. So sometimes if I'm meeting someone new, I might try to see what other places they're serviced by and see if I've had other clients from there so I know what terms they use. So that maybe I can try using those. But does anyone have an idea for what else you could call it besides case management? I know, hard questions. I'm sorry. Actually, I'm not sorry. I like to challenge people.
We refer to that work as peer bridging.
Peer bridging.
And then I also heard, not for case management, but a new term today, and maybe I think I heard you say it as well, but I don't think it's used so much in California, about forensic peer navigation. So being a peer navigator instead of a peer specialist. I liked that.
Peer specialist, peer support, situational mentor. I like that one. I might actually take that one if you don't mind. I actually like that one. I might start using it. It's just, trying to find out what to call it. No matter what it is, it's how do you call things? Okay. So sometimes people will use terms for themselves or for a place or for a service that they need, but they don't want you to use that term. That's confusing, right? Why can you call yourself, and I'm going to use myself as an example. I am on the autism spectrum. I have Asperger's. And I'll call myself an Asperger. I have no problem. I love that name. When I use it, don't you call me that because I will hate you. That is an immediate turnoff for me if you call me that. So, we want to use synonyms, we want to use their preferred language, but we don't want to use a term that triggers them at the same time. So I know I'm talking on both sides because there is two sides to the issue. It's back and forth. Which way do you go? So do you have any examples of things of that? Another one is I'm in New York. I'm in upstate New York. If I say I'm going to the city, I mean I'm going to Albany. But other people, and I grew up in New York City, so when I said I was going to the city, I meant Manhattan. So, being aware of the context also makes a big difference. And telling me, well, New York City is not the city, you will set me off beyond belief, because that's what I call the city. Or now I've adapted, but back then that was, very triggering to me to be corrected. I didn't like it. But you couldn't call it that. You had to call it New York City, but I could call it the city. So it was very fun dealing with that. Thank you, Joseph. Hey, don't, I'm pasty, but don't call me vanilla or Manila. Definitely, you know, I could look one way, but that doesn't mean you should use it unless you know I'm comfortable with. In terms, I'm going to use pronouns again because I was asked to talk about pronouns. In terms of even just something as simple as you want to go to the John, that always turns me off. Would you like to go to the restroom? Yes. Would you like to go to the bathroom? Sure. Don't use male slang on it, even though I present as male. I hate male slang. Sorry to the men, but I don't like it. I'm a he, but I don't like it. So being aware of that, because don't, if you're around me, make sure you're not telling any Jewish jokes that are nasty. Chloe, definitely. I don't like, if you're Jewish, that doesn't mean you want people to call you that. You want to be called something else, or you don't want that to be acknowledged. There are a lot of things that we just don't want to acknowledge about ourselves. And if someone else brings it up, it can be a trigger. It could be something obvious.
Just the difference between being called Jewish versus a Jew by somebody else feels strange.
Derogatory.
Yeah, derogatory.
Feels derogatory. Just being aware that, even though the person is referring to themselves as that, doesn't mean that you can. And you may not be comfortable asking them, but you can just, if you're using it, try to pay attention to their body language or how they're reacting to you. Did they just suddenly close off on you? Did they suddenly just open up to you? Which way did it go? So that you have a better sense of how to go forward with it. And yes, you'll make mistakes. I still make mistakes. But just being aware of it helps me to cut down on the number of mistakes I make. So, I can say it, but don't you call me that. Don't you call me trans. I do not like being called trans. I'll call myself trans, but don't you dare call me trans. No. That's a big no. The term gay. And again, I'm just using that because I was asked about the pronoun issue. Don't use that because you don't know which way it's going. Because gay could mean just the men, or it could mean the whole culture. So being aware of that. Things like that. So the terms, if you hear someone using a term, feel free to ask them, would you like me to use that? Or just pay attention if you use it to them. So language choice does go both ways. And what if Joseph, definitely tone. Tone plays a big part as well. And that's part of nonverbal language, which is also something we need to be aware of. What does our nonverbal language say? I know in all my trainings, I was told, don't do it. You can't be doing anything while you're with a peer. Like I can't be writing or crocheting. And I'm like, I need to crochet to stay calm. So when I meet a peer, I say, I use crochet to stay calm. This is going to help me focus on you. Is it okay if I do that? And if they say no, I will try to manage, but usually they accept it and they say, no problem. I stopped bringing knitting because the clicking of the needles was too annoying to people. So I had to, find a way that I could fidget and still be present, because without fidgeting, I'm not present. But if I fidget without explaining to people why, they think I'm not paying attention. So, being aware that of body language and what it means. So, for example, if you were with a peer and let's see, and suddenly they started shaking, what would your initial reaction be? And I'm shaking right now, just so you know. That's what gave me the idea.
I know better than this, but my impulse might be to like touch a shoulder, you know?
Touch. The impulse would be to touch a shoulder, maybe to wonder, are you okay? Should I be calling 911 on you? And with me, it just means put my yarn in my hands. And put the yarn and hook in my hands, and I'm going to calm down. I am not crocheting during this session. Don't worry, I wouldn't do that. But it's something that being aware of. And, and touch is another language. It's not the verbal language, but it is a language. Some people like touch or even proximity. What is someone's personal space size? How close can you get before they freak out or they become uncomfortable? And how do you learn about this? How do you discover this without, because I don't want to sit with a peer and go, okay, how close can I get to you? And go down this whole checklist. What should I call you? What should you call me? How close can we get? Can I touch you? Can I, it's that, to me, that would just be like, well, as the peer specialist, I would be like, oh God, I feel like I'm going down a checklist. And as a peer, if someone was doing that to me, I'd be like, okay, this is too clinical. I'm leaving. Goodbye. I don't want to talk to you. So how do you do this? When do you do it? How do you find out someone's sense of personal space without specifically asking them? And that's something I'm struggling with, so I could use some tips.
Can you repeat that once again, please?
Sure, sorry. How would you approach trying to figure out someone's personal space without specifically saying what distance of personal space how close can I get to you?
Well, I'll kind of add into what you just inquired and then what I'm reading in front of us. I was putting in the chat line, I'll put in there, but I'll speak it out loud. This support is of mutual share and respect, so let's maintain to this agreement. And if there's a moment where boundaries of personal space is, then let's mutually talk about what would be an okay or a welcome space offering for that.
Definitely, this is mutual. Let's, open up. If I'm crossing a boundary for you, please let me know. Knowing, the peers' senses, which ones are their best. Gary Chapman has this whole series on the 5 love languages. If you haven't read it, it's wonderful. Teaches you about the 5 different ways that people receive and give acknowledgement, whether it's love, acknowledgement, or anything else. And it really helped me to comprehend why one language that's nonverbal is, I've had clients or peers who insist on giving me something. Every time we meet, they give me something. And it was driving me crazy because I really don't want any of the stuff that they're giving me. It's not useful and I'm allergic to it. And I would say, no, it's okay, you can keep it. And then I realized after reading Gary Chapman's book, their language of acceptance of you is through physical gift giving. So the more and the days I accepted the gift, they were more open to me than the days I said no. I think because they felt it was more reciprocal, maybe. I'm not sure. It can also be in terms of acknowledgement or figuring out rewards for yourself. I have no intrinsic motivation whatsoever. You can tell me do this because it's good for you, and I'm going to say no. Tell me do this because it's going to help me. I'm out there doing it. I will rake your leaves, no problem. I will not rake my own. For some reason, I cannot do my own leaves, but I can rake 5 other people's. I need that extrinsic motivator. So that's something, to look at, how do you encourage people? How do you engage them? How do you keep them going? How do you acknowledge when they've done something good? Do they want is a sticker or words of happiness better? Which would make them feel more accomplished? Which way would you feel most accomplished? If I gave you a sticker, if I told you great job, if I clapped for you, or if I gave you a high five, or if I hugged you. And you're all thinking, right? Which way would I like to be acknowledged? And there's no right or wrong answer.
I think I love that Gary Chapman work, and I'm glad you brought it up. I think probably, I guess this goes to the point. In many cases, physical touch is one of the love languages that works for me, but not with everyone,
And Joseph likes verbal the best, but they'll take a sticker too. And here's something to consider. I have not touched anyone willingly or let anyone touch me except my doctors in, I think it's now 12 years. I cannot touch people. But I've had some peers that their language is touch. And I've had to overcome that so that I can encourage them and support them. And I have to try to remember not to stiffen up when they try to give it back to me. And I still stiffen up because I'm so non-touch. But, that's how they like to be acknowledged. And it's requires me to think and be aware that I now just wear long sleeves so that they're not touching my skin and it's a little easier. Even though I love short sleeves, I now put on long sleeves when I'm going to be working with peers to be able to control my shivers. So how do you do it so that you're both comfortable? I know people who hate saying good job. Well, actually, to me, that just feels like I'm talking to a dog. Good job, good job. But for some people that I work with, that's the way they like to be acknowledged. So I have to find a way to do it that I don't feel like I'm talking to a dog. And no, I don't think they're a dog, but to me, saying that, it feels like saying, good boy, you rolled over. I can't do that. But that's what they want, or that's what they need. Very impressive. Yes. That might, I might try that one, because I've got to figure out something for people where I'm not uncomfortable either. Because remember, this is we're in peer relationships. We are helping them, but we also need to be aware of ourselves. So, because if we're triggered, we can't help them until we get out of our triggered situation. So it's being aware. And again, language, it's verbal, it's nonverbal, it's action, it's movement, it's any way that you communicate with someone else. If someone's fidgeting while you're talking to them, you might want to try to find out, is this how you focus, or are you uncomfortable? And how might you try to ask that without being like, why are you moving around so much? And I can't tell you how many people have yelled. It's not, I know I'm asking a lot of hard questions. That doesn't mean you have to answer them now, but keep them in your mind as you go forward, and start being a little more aware of these things when you're working with people, and if I can just raise your awareness that there are all these different communications going on, and just changing the word or the way you present the information might make a big difference. So, what can I do? Or what can you do? I like I statements. I don't like you statements. And that's another language choice. I prefer I statements, but some people might prefer you. So I have to be aware of that. Pay attention to preferred language. We, some people like we. To me, that feels like I'm talking to a British royal person. I don't know why. I watch a lot of British drama. That might be why. So paying attention and recognizing cues. Sometimes it's just not even being, it's just being aware to those little cues, a shiver, moving back a little bit, a smile that they like it, or that they calm down, you see the tension easing. Sometimes and that can be hard to pay attention to and interpret. And sometimes it takes a lot of training and effort and practice to be able to read people like that. But it's an important thing to pay attention to, because they say actions speak louder than words. They really do. Because I might tell you, it's okay. It's okay if you touch someone touches me, but my body is shrinking away and trying to go to another room. And if you paid attention, you would realize I really am not comfortable. Even though I said it's okay, it's not. So being aware of that. And, also being open to ways other people phrase things that you may not have heard of. That's also kind of important. And then trying to build your own base of synonyms. And most importantly, if you're unsure, ask the peer what term or method of communication they prefer. So questions, comments, reflections, you can critique me, it doesn't bother me. Any thoughts?
I was thinking, especially when you were talking about possible, I don't know if your reaction to Merry Christmas, and then the way, I think a number of years ago, once people first started using Happy Holidays to be all inclusive, now I feel like there's almost been a backlash, again, using the same example, where people are sort of offended and assert their position on wanting to be less inclusive with their word choice. I'm wondering if that is something that you've had some experience with or can relate some wisdom around how you deal with that.
I usually just respond with whatever they say to me. I will say happy holidays, or I'll just say hi. I generally just ignore all holidays because I don't recognize holidays. They are triggers for me. But I'll respond to anyone with whatever they said to me. Or if I know what they practice or their preferred phraseology or movement, I will return them. If someone comes up and hugs me, I will put my arms in the same exact position on them that they're on me. Because I don't like hugging, I hate hugging, so I will just mimic. I don't know if that answered your question.
It did, yeah. It sounds like even if you're sensing some hostility, or mirroring works well in your practice.
So sometimes it bites me, but usually it works.
Thank you.
All I can say about all the gendered stuff, it's becoming more and more common to use generic, non-gendered terms for everything. One of my favorite examples is, don't point me when you have a client come in and they ask, where's the bathroom? Unless you know which one they prefer. Men's to the left, women's to the right. Say both like it's normal. Because that way they can go. Yes, the parrot technique. Joseph, I definitely parrot people if I don't know what to do. But just being, not assuming genders. Because I present as male, but I wear a skirt. And having people try to figure out what bathroom to tell me to go to is always fun. I like watching them. It's always an adventure when I ask, where's the bathroom? Says that voicing your triggers in a respectful way is something they always encourage. And definitely, I ask people, please, if I do something that's triggering to you, or if you have known triggers, please let me know so that I can try to avoid them. And if I make a mistake, please correct me. And yes, I still correct them when I'm near my peer, and she keeps telling me spit out the gum because I keep forgetting when I go to meet her for help.